Health insurance is the #1 financial concern for freelancers. And in 2026, it's gotten more complicated. The enhanced subsidies that made coverage affordable for millions of freelancers, they expired. That means higher costs for many self-employed workers this year. But here's the thing. With the right strategy, you can still find affordable coverage. Let me show you exactly how. Note, this information applies to US-based freelancers. First, let's talk about why 2026 is different. From 2021 to 2025, the government boosted ACA subsidies significantly. Freelancers earning above $63,000 could still get help with premiums. That's no longer the case. In 2026, if your income exceeds 400% of the federal poverty level, about $62,600 for a single person, you're back to paying full price. And full price in 2026 is a lot higher than it was 5 years ago. The average unsubsidized premium? Around $752 per month. That's over $9,000 per year just for health insurance. But if your income is under that threshold, you can still get significant help. Most people with subsidies pay an average of just $175 per month. So let's explore your options. Option 1. The ACA Marketplace. This should be your first stop. Even with the subsidy changes, the marketplace offers the most comprehensive coverage available to freelancers. Here's how it works. You estimate your income for the year. If you're between 100% and 400% of the poverty level, that's roughly $15,650 to $62,600 for a single person. You qualify for premium tax credits. The lower your income, the bigger your subsidy. At 200% of poverty, you'd pay about 6.6% of your income for a benchmark plan. At 400%, it's capped at about 10%. Plans come in 4 metal tiers. Bronze plans have the lowest monthly premiums but highest out-of-pocket costs. Platinum plans flip that equation. Silver and gold fall in between. Here's a pro tip for 2026. Every bronze plan on the marketplace is now HSA eligible. That means you can pair a lower premium bronze plan with a health savings account. Why does this matter? HSA contributions lower your taxable income. A freelancer earning $70,000 who contributes $4,400 to an HSA brings their income down to $65,600. That could push you below the subsidy threshold. Option 2. A spouse's employer plan. If your spouse has a job with health benefits, this might be your easiest path. Family coverage through an employer is often cheaper than individual marketplace plans. Check the costs carefully, though. Compare the premium, deductible, and out-of-pocket maximum to marketplace options. Sometimes a subsidized marketplace plan beats employer coverage. One important rule. If you're eligible for your spouse's employer plan, you can't claim the self-employed health insurance deduction for that coverage. Keep this in mind when doing the math. Option 3. Health sharing ministries. These aren't insurance. They're communities where members share medical expenses. Popular options include MediShare, Samaritan Ministries, and Christian healthcare ministries. The appeal? Cost can be 50% lower than traditional insurance. No open enrollment periods, you can join anytime. And no network restrictions. But there are serious trade-offs. Pre-existing conditions are often excluded. There are coverage limits, sometimes as low as $125,000 per incident. And here's the big one. If they don't pay your claim, you have no legal recourse. These organizations aren't regulated like insurance. Health sharing can work well if you're healthy, have faith-based values that align with the ministry, and understand you're trading coverage guarantees for lower costs. Option 4. Professional associations. The Freelancers Union has offered health coverage to independent workers for over 20 years. Industry groups and trade associations sometimes offer group rates too. These plans vary widely in quality and cost. Do your homework. Compare them to marketplace plans before committing. Option 5. Short-term health plans. These provide temporary coverage, usually 3 to 12 months. Premiums are lower because coverage is limited. They often exclude pre-existing conditions and don't cover preventive care. Some states ban or restrict these plans entirely. They're not a long-term solution, but can bridge gaps between other coverage. Now let's talk about the freelancer's secret weapon, the self-employed health insurance deduction. If you have net self-employment income, you can deduct 100% of your health insurance premiums. Not just health insurance, dental and vision too. This isn't an itemized deduction. It's an adjustment to income, which means it reduces your adjusted gross income even if you don't itemize. You'll report this on Schedule 1 of your tax return using Form 7206. The deduction can't exceed your self-employment income from the business that establishes the plan. Let's put numbers on this. Say you pay $750 per month for health insurance. That's $9,000 per year. If you're in the 22% tax bracket, that deduction saves you $1,080 on federal taxes. Combined with the self-employment tax savings from lowering your AGI, the real tax savings could be over $2,500. Here's my recommended action plan for 2026. Step 1. Estimate your income carefully. This determines your subsidy eligibility. Overestimate and you might miss out on help. Underestimate and you'll owe money back at tax time. In 2026, there's no longer a cap on repayment of excess subsidies. Step 2. Visit healthcare.gov during open enrollment. Compare plans and see your subsidy estimate. Open enrollment runs November 1st through January 15th. Step 3. Consider an HSA-eligible plan. Bronze plans are all HSA eligible in 2026. Max out that HSA to lower your taxable income and save for medical expenses tax-free. Step 4. Use subsidy calculators. Sites like healthinsurance.org have 2026 calculators that show your estimated costs based on income and location. Step 5. Talk to a tax advisor. Your retirement contributions and HSA contributions both reduce the income used to calculate subsidies. A professional can help you optimize. The bottom line, health insurance for freelancers in 2026 requires more planning than before. The subsidy cliff is back, and full-price premiums are expensive. But you have options. The ACA Marketplace still offers quality coverage with subsidies for many freelancers. HSAs provide tax advantages. And the self-employed health insurance deduction puts real money back in your pocket. Don't let health insurance be the reason you stay in a job you hate. With the right strategy, you can make freelancing work financially. If you found this helpful, subscribe for more freelance finance tips. And check out our video on tax deductions every freelancer misses for more ways to keep more of what you earn.